Chronic obstructive pulmonary disease, COPD, affects a huge number of adults globally, especially people aged 40 years and older. Major risk factors include tobacco smoking, air pollution, occupational dust and chemicals, and also indoors gases and biomass fuels from automobiles. On the other hand, asthma is the most common chronic disease affecting children globally. Every breath matters, yet for millions of lives around the world, breathing is a daily struggle.
Yeah. But I'm not like somebody that's going like that or the whole day or every day. I'm not someone that's going like that, you know. But I'm all right, man. I don't know, yes, I'm all right. I don't know how it comes from that I it's so short of breath sometimes.
Data shows that chronic respiratory diseases, COPD, and asthma, amongst other respiratory ailments included, cause millions of deaths every year. The burden is highest in low and middle-income countries, where diagnosis and treatment are often limited.
Because chronic respiratory diseases, asthma, COPD, and other lung conditions cause millions of deaths each year. They limit productivity, they strain health systems, they deepen inequality, but they do not begin with numbers.
In Cape Town, South Africa, though highly developed and ranked amongst the best cities in the world, economic inequalities, poverty, exposure to high air pollution from allergens, carbon emissions, and the overall high disease burden have contributed to the high burden of respiratory diseases. At Headveld Community Day Clinic, drug and substance use is also contributing to the high admissions at the health facility.
Patients with chronic lung disease amounts to almost about a third of our admissions per month, and this includes COPD due to smoking, cigarettes, as well as substance use. Substance use is a big problem in the community. Substances like methaqualone, heroin, cannabis, crystal meth is quite huge in the community.
At the Red Cross War Memorial Children's Hospital is a different story. Children are admitted due to asthma and other respiratory diseases.
When Lauren was born, a little baby, I saw some red skin on her. So I didn't know what it was. So she grew up as a, she has this eczema. So I get it treated for that. So they give me the treatments for her skin. So there was no actually thing about asthma. The asthma just started at the age of 7. Yes, when she was 7 years old, she started to get the asthma attacks. It always starts with the flu or some fever. And after that, I just have to rush with her to the hospital until they discover that it is asthma.
Experts believe Africa has got long pollen seasons, hence the high asthma prevalence in children.
In Africa, we've got different grasses, we've got much longer growing periods across the continent, and our grass pollen seasons are very, very much longer. So we don't really even have seasonal allergic rhinitis. The new classification is persistent or intermittent allergic rhinitis to account for the fact that our pollen season is actually almost the entire year.
So according to the research, 17% of teenagers in Cape Town at the age of 13 to 14 have some sort of history of asthma. So if you work that out, it's 120,000 people, teenagers in Cape Town, who might need care for asthma.
Experts believe no amount of pollution is safe.
All of air pollution has both what we call particulate matter as well as chemicals. And it very much depends on which fuel, which chemical, which factory is producing the pollution as to how much risk there is. There's no such thing as safe pollution.
Heidveld Community Clinic now runs a specialized clinic with a palliative care program designed to help patients.
We've done some research trying to see what the challenges is for people that is palliative care in the communities of Heideveld and Manenberg. So what we've done so far is speaking to family, friends, even patients themselves.
Thinking about how we can leverage local networks of care, pull in different actors, like government actors, NGOs, community-based organizations, members of the community to take ownership of palliative care in different communities.
In communities across the Cape Flats, asthma and COPD continue to take a heavy toll on children and adults. Behind every statistic is a person struggling to breathe, a family adapting, and a health worker doing what they can to help. The challenge now is ensuring that prevention, treatment, and support reach communities.
Safety